Hi, I'm Dr. Gaby Cora at the National Publicity Summit, here meeting with another doctor, Dr. Meghan McGovern. Dr. McGovern, how are you?
I'm well, how are you?
Good, excellent. You do something that many women and men are extremely interested in these days. Tell me about it.
Well, I'm a plastic surgeon and I do a lot of facial rejuvenation, and I tell my patients the vast majority of time to forget surgery. I want people to look natural and normal and to look at their personal best, and we have a lot of ways of achieving that now that don't involve a knife.
So a lady comes in to see you, she's looking for plastic surgery, and you say, hold on. Mm-hmm. Is she surprised?
Yes.
Yes, very much so.
Yes.
And then what options does she have?
It's very individual for each person, but predictable. We all accumulate sun damage. We all lose elasticity in our skin, and when we do surgery on someone with sun damaged skin, we're just moving their sun damaged skin over a little bit. We're not addressing what's really drawing the eye and making them look older than they want to look. I start at the surface. I start at layer one, which is the skin, and then I look deeper, and I look at the shallow soft tissues. I look at their muscles. I look at the deep structural fat, and I look at their bones, and we can restore each layer and restore it to a more youthful position, more youthful shape, more youthful projection, and give them a look that looks like themselves, because it's how their face used to be shaped.
So give me 2 or 3 examples, real life examples from different situations, men, women, you tell me, of a couple of typical cases. I know that you've had several videos done with different types of situations. So share with us 2 or 3 different ones that could give our audience a good idea of the options.
Okay. Well, you mentioned men, and one of the things that I find with a lot of men is they come in almost with more fear than women do, because they don't want to be feminized. They want to look masculine, but particularly men who are in really good shape. They lose their structural fat, they lose their deeper soft tissue, and so we can restore the projection that their face used to have that they've burned off by exercising so much. So we can give them a softer, more youthful look and more youthful profile, so they feel more confident that way, but still look like themselves, and they don't look like women.
That's a great example.
So many women come in and they say, well, I just need plastic surgery, I want to look better. But really, they just want to soften, they want to get rid of the shadows and lines they don't like. And by looking at each person, it's often restoring volume where they've lost it. The other thing that happens as gravity pulls downward on us, we have structures deep inside our face that get looser that we used to have to use a facelift to correct, and now we have a tool that is a high-intensity ultrasound device that tightens that structure without surgery and without downtime. So we can achieve a global tightening effect with or without adding volume. So patients can really customize what their goals are and what they're looking for and what they want to do.
Now, young women in their 20s are now told that they will start having some wrinkles. So you have some young girls starting Botox at an early age. Mm-hmm. What do you do with those young patients who may want to come in, and not because they may want to change the structure of their nose or something like that, but because they start feeling old, or they want to get rid of all the wrinkles in their face? What do you have those cases, and what do you do with them?
I think it's important to achieve balance. It's this one of the classic things that we talk about is the lines only happen where the smiles have been. It's not normal to have no lines on our face. And when patients when patients start chasing the lines too much, I really have a frank conversation about maintaining yes, we all want to look youthful, but we want to look normal, and we want to interact in a way socially with people where people can tell our emotions. And getting rid of all of the motion on someone's face is not normal, and I counsel them to avoid those things.
Lovely. So a lot of education there too.
Education. Yes.
Any other case or situation that you would like to share with us?
I guess I'd like to backtrack a little bit and say that there are people who are coming in younger that have realistic questions and realistic changes on their face and early sun damage changes, and who do want to do a little bit of Botox. It's not like I never do Botox on someone who's below 35 or something like that, but I just want to make it clear that my goal is to keep them looking natural, but if you start getting some hyperdynamic lines or migraines from stress and those kind of things, there are things we can do to soften and improve it, but we want to look and maintain a more youthful profile, a more natural profile.
Wonderful. How can people reach you?
I have a website, drmcgovern.com, and we actually have a website called forgetsurgery.com that shows some of the videos that we've put together to show people some examples of what other women have done, their story, what made them do it, and what it's done for them and for their lives. So people can kind of connect that way.
So forget surgery. Who would have said? Thank you so much for joining me.
My pleasure.